Hi, I'm Aarti from Smile Digital Health. This video is packed with compliance goodness for payers. We're going to hear about successful compliance implementations for payers from industry experts. We're also going to learn about how some innovative peers have been working with us at Smile Digital Health to build out proof of concepts and automations within the prior authorization workflow. Joining me today are my colleagues from Smile, Jennifer Baird, VP of Sales and Marketing Strategy for US Payers, and Peter Yu, our Director of Technical Product Management. Both Jennifer and Peter have been working very closely with US payers over the last several years, implementing compliance solutions, so we're really lucky to have them with us today. Jennifer, I'm going to start with you. Could you please give us a brief overview of the CMS interoperability and prior authorization final rule, lovingly called 0057F, and tell us why it's important to the entire health ecosystem?
Sure, thanks, Aarti. The new mandate, finalized in January of this year, describes many APIs and even more HL7 IGs, and is much more expansive than the original patient access rule, the CMS 9115. It has more impacts on things like consent management, member attribution, and receiving external data from both providers and other payers. These requirements are all outlined in the patient access, provider access, payer-to-payer, and prior authorization requirements, documentation, and decision, also known as PARD, APIs. This rule is important to the healthcare industry because the key principle underlying it is to advance interoperability. Payers and the entire healthcare industry will benefit from having the right data when and where they need it. We're very lucky at Smile to work with some large innovation partners to advance efficient solutions to these challenges.
Right. So thanks for that intro and that high level, Jen. Can you explain to us what is the real opportunity here for payers and the healthcare system at large?
Right. So the CMS rules 9115 and 57F, I'm even shortening it further, are not just about checking a mandate box. They are designed to support the larger strategy towards value-based care and improving patient outcomes through making data accessible across all of healthcare IT ecosystems, whether you're a payer, a provider, or a patient. One massive workflow component of 57F is prior authorization. Earlier this year, the AMA published an article about prior auth exhaustion. There's a shocking stat in there. 78% of physicians reported that prior auth burdens, wait times, and delays often result in their patients abandoning a recommended course of treatment. That's a horrible unintended consequence. The solutions we're going to talk about today create automated workflows across the systems so patients do not have to abandon or delay their treatment. They know in the exam room whether or not their treatment is authorized. And that high quality care can be delivered cost effectively. That's the real impact of interoperability and the biggest opportunity that we have here today.
Right. So the CMS 0057F is a recently finalized rule. Can you tell us a little bit about the successes you've had with compliance for US payers?
Sure. So as you know, there was an earlier mandate effective in 2021. I mentioned it, 9115, also known as CMS Interoperability and Patient Access Final Rule. And our solutions for payer customers, both our payer-to-payer API, as well as our patient access final or API, were quite successful in supporting those. Those current implementations impact over 100 million US lives through those payers. And we know that we were successful because those payer clients gave us an A rating in the class research survey that was taken. And I am going to take just a moment to boast here because we are actually one of the few companies that have achieved Drummond certification. And that affirms to the end-to-end interoperability and functionality of our solution. Anyone in the industry aware of Drummond knows that these certifications are super rigorous and they do attest to our success that we've had. And we value it so much that we actually just recently got recertified as well this year. And now we are building towards the 57F compliance with several of these same payer clients and many new ones. The beauty of our original solution is that the platform is upgradable to manage the 57F requirements, giving us plenty of time to go through all of the solutioning, implementation, and training well before the enforcement date of January 1st, 2027.
Yes, and that is a fast approaching date. Thank you so much for that, Jen. Peter, I had some questions for you. So the CMS 57F rule includes prior authorization, as Jen mentioned, and it has the highest level of complexity and integration. Can you tell us how you deal with these complexities and how Smile proves them to payers so that they know we can deliver?
Artie, you're absolutely right. Prior authorization is very complex. In the payer world, there are many internal delegated systems and processes to consider. For large payer providers, their prior auth workflow will integrate multiple IT systems across all business lines, and this includes their internal UMs, which is their utilization management systems. So let's explore the ecosystem in the CMS 0057F ruling. You have one side, which is a network of providers with all different types of EMRs and EHR systems sending prior auth requests. In the center, we have the payers intermediary systems, which in our sense is Smile. Then on the other end is where you have payers' existing legacy system that processes claims, database, and adjudication, all which have to work harmoniously together for the prior authorization APIs to work. And these APIs that we're talking about are three things. The first is CRD, which is coverage discovery. The second one is DTR, which is documentation and questionnaires. And the third is the decision process, prior authorization support pass. That talks about the prior auth request and response. To your question specifically, when it comes to proving the values to our payers, our preferred way is actually connectathons and proof of concepts. This is simply to showcase our solutions to the whole industry, to demonstrate how Smile deals with simplifying the process, simplifying the solution, and the ease of integration into their ecosystem to deliver true interoperability. In our experience, we figured Connectathon is a really good way to motivate payers to get them on board with their data modernization, which subsequently, once they're convinced at a Connectathon event, it leads them to be a champion going back to the organization for these direct change management efforts to really spearhead these initiatives to modernize. There is a deep technical integration that's required by the payer, and that means getting internal buy-in and going through change management is very, very, very important. In our Connectathon, our clients are allowed to test all their connections with existing actual systems between other payers and other providers, and some of them are actually the players that they deal with on a day-to-day basis. So when there is a point of failure, everyone is on the same page and they understand what needs to be fixed and to move forward. And when they see a success of data flowing through from end to end, it's very exciting because it's instantaneous. We just actually completed a Connectathon with a US Blue organization, that's our client, to prove our ability to deliver automation for all three, coverage discovery, documentation, and prior authorization request and response, all through our clinical reasoning engine and through full automation end to end. And it was incredible. Our solution suite for CMS prior auth ruling has various levels of automation built in. We're able to connect payer system and complete all the steps, again, from discovering if a coverage is required for prior auth, filling in the documentation, and auto-filling in the questionnaires and submitting that prior auth for adjudication and processing the adjudication all in FHIR synchronously. That is a complete end-to-end true interoperability of what Smile has been telling everyone in the industry. It drives tremendous business value, and it is very obvious that through our Connectathon, participants and for most of our clients are very excited of what we have to deliver to the market. Now that's a technical part, but there's also business processes and permission issues that needs to be discussed in these payer organizations. That is why we keep saying the motivation and internal change management becomes very important for a lot of these payers. Another example, another client that I want to bring towards attention is this very innovative US payer decided to not go through Connectathon, but they really decide to do a proper proof of concept with Smile. They opt in the internal path, but how they did it was very surprising to us. On the initial kickoff, when we were invited to the call, we were invited to a call with a massive audience of 12 internal teams with Smile. And the reason for this large kickoff is to ensure that the implementation roadmap, the policies, the permissions, all the potential roadblocks, all the things are considered, are at the table, considered, addressed, documented, and have subsequent actions and meetings to discuss. Both these clients are well underway to get their compliance and modernization and their policies aligned by end of 2024, so they can focus their effort in 2025 and onwards to make sure the technical solution, the Smile product, can be fully integrated in their solution for prior authorization. The CMS 0057F ruling and the prior auth components is very complex, but how we see it is actually a great opportunity for the US healthcare system to evolve. Some of our payers are understandably focused on, we'll just put the APIs there, we'll put a middle layer for communication to check the box for the requirements. However, how we see the market is the US healthcare system is moving towards a value-based care, and a cost effectiveness is very important. So why just stop at just putting the APIs? Why not modernize? Why not put more automation to make process efficiencies as well as cost-saving initiatives all in one implementation? With our Smile CMS suite of products, we're demonstrating exactly how we achieve all these automations in real time, and with built-in adherence, even more automation can unlock after prior authorization. More deep dive into analytics such as care gap and digital quality measures.
That's so cool. And yeah, that's a really good question. Why stop here? Why not continue and modernize? So this is truly revolutionary because it goes beyond what the mandates require today, and we're building towards value-based care and everything that's coming up in the future. So for the sake of our audience today, who are probably payers, can we dig into those levels of automation that you mentioned from prior authorization? Tell us, what exactly do you mean by that, and how does it work?
Absolutely. So before we talk about automation, let's talk about the foundational aspect. All the data obviously has to be in FHIR. Then to meet the CMS mandate is to integrate the 3 APIs for coverage discovery, documentation, and prior auth submit. These are just the basic 3 things that needs to be in place. There is no automation, and at minimum, it will meet the requirements for CMS 0057F. But we don't stop there, because the APIs, just having the APIs is not the full intent of the rule. We want to be able to deliver real-time savings and interoperability and scale it across the payer and provider network. The bulk of the automation comes in around using our clinical reasoning capability within the Smile platform. The ability to reduce burden both on the payer and provider side when it comes to the prior authorization transaction, all in FHIR, all the decision-making, all in FHIR. So forward-thinking payers are moving forward beyond the checking the box mandate and taking a huge opportunity here using Smile and its clinical reasoning capability for cost savings and business transformation opportunity. So I mentioned a lot about clinical reasoning just now. So at Smile, we have this amazing CQL engine, CQL, that stands for Clinical Quality Language. It is a standard with HL7, just like FHIR, that works nicely together, is an authoring language that can express and read clinical decision support content to be computable. So what do I mean by that is, to make it simple, is we can make payer policies computable. We can take these PDFs and these documents and make them FHIR knowledge and decision trees. So as request comes in as FHIR data, we can run it through this decision tree to make a decision at the end, such as, does this claim require prior authorization or not? FHIR and CQL work together incredibly together. That unlocks 2 powerful mechanisms, one for the payer, one for the provider. As payer, I just mentioned, there will be real-time communication between the provider and payer when it comes to prior authorization task. And from a provider perspective, this unlocks an accurate and accessible clinical decision support tool as an enablement tool to create CDS capabilities. So now back to the automation. At our first level of automation, we start with CRD, which is the coverage discovery, making it more intelligent. We automate the call between a provider's EHR and the Smile clinical decision support tool on the payer side to determine at the end, when you are about to submit a prior auth, does this prior auth require a prior authorization or not? In our experience, 50% of prior auth inquiries actually don't require one. So by being able to programmatically put this as a fire knowledge and running these inquiries through that fire knowledge all in the Smile platform, we're able to achieve a lot of cost savings, a lot of reduction in burden with administration. So think about that. This saves amount of time, cost, resources, and the delightful experience from a provider and a member perspective. It's quite awesome. So Jen, do you want to take a few moments to talk about the next couple layers of automation?
Sure. Yeah, I'll talk about the second layer of workflow automation that Smile offers. And it starts with actually codifying those medical policies for individual procedures that you had mentioned earlier that we can do in our clinical reasoning engine, Peter. With these authored into CQL, we can actually automate the entire prior auth process from beginning to end. So this way, the patient and the provider will know in the exam room, not only if that procedure requires prior auth, as you said, 50% sometimes don't from what we've experienced, but if it does, they'll know whether or not it's even approved. So some payers have thousands of medical policies. We recognize that. So maybe starting off with 1 to 5 of the most commonly requested ones is a low-risk way of gaining some significant return on your investment. Because once these policies are in CQL, the system can actually grab the appropriate documentation from the provider system and then run it against that medical policy and return that response via the APIs, all in near real time. Now, the third level of automation continues this momentum. Once the benefits of having a few medical policies codified for automation are realized, a payer can then continue to author the rest of their policies according to their own timelines until their entire system is running fully automated. This allows for the most optimal experience for providers and payers in reduction of burden and in the ability to reallocate those resources along the prior authorization approval process.
And I would like to add something too. And an additional benefit of authoring your medical policies in CQL is that they can be reused for other departments in your organization, like quality measures and care gap management, as I mentioned before. If a policy changes, you only need to change it in one place and it flows to all the other areas. So there's a huge benefit of it scaling and in terms of our maintenance of these policies in a very quick and efficient manner. But these topics in terms of CQL and clinical reasoning deserves a topic on its own, and we'll save it for other webinars in the future.
I'll take note of that. But wow, I mean, what you both have just described is pretty incredible. You've basically shared with us proven ways that streamline prior authorization workflows in real time that are automated and fully compliant, and I assume enhance care outcomes. So, wow. To be clear, has Smile successfully demonstrated these automations that you've discussed with a payer, like as of today?
Yes. We have been able to fully automate the prior auth approval process with our payer customers.
Wow. Okay. And is Smile able to support any new payers coming on board who are looking for a solution to 0057F, as well as starting to build out these automations that you both just spoke of?
Yes, absolutely. We are currently supporting over 20 payers with their CMS compliance requirements, and the technology is ready. So if you are a payer looking for a solution, contact us at the information that you'll find below, and we will be happy to discuss how the Smile CMS suite can fit into your existing ecosystem, and also help you design that roadmap that Peter and I outlined that will help minimize your change management and risk while still setting you up for success well beyond just checking the mandate box.
That's brilliant. Thank you, Jen. And Peter, we're coming to a close in this video. So can you tell us, or can you share with our audience, what advice do you have for payers who are about to embark on this journey?
3 things. First thing is understand the importance of true interoperability and the role of open standards like FHIR and CQL, how it plays into this whole big picture of evolution. It does not only meet the CMS mandate, also it is a way to change how prior authorization is done and how it changes your business in a very positive, good direction. The second thing is, do not think CMS 0057F is just a checking the box exercise. I mentioned a few times through this webinar. See it as an opportunity to modernize your systems, achieve true interoperability, and drive efficiencies by automation to deliver higher customer satisfaction and cost effectiveness. The last thing is, payer will need to go through this phase of discovery, implementation, and internal change management. Do not underestimate the complexity and the time it requires. So start early, start exploring today.
Start exploring today is right, because the enforcement date is coming up really soon. And some of these large payers have a lot of, departments, as you mentioned, to gather. Jennifer and Peter, thank you so much for illuminating the compliance journey for payers, both to meet the mandates and to take us to a world of value-based care. Payers and audience, anyone who's watching, our contact details are below. Please reach out to us today and get started on your implementation journey and processes, or if you want to run a proof of concept with us through a Connect-a-thon. As well, if you're watching on Smile's YouTube channel, please don't forget to hit the like and subscribe. We will continue to drop videos on mandates, as well as several other topics that impact the world of health IT. Until next time.